All right. Good morning, ladies and gentlemen. This is Right Place Water Quality Dialogue. This is actually the maiden edition of this particular dialogue. My name is Bonaventure Asonyewankama, and I'm the Program Director, Right Place Health. I will be your moderator this afternoon. Before I continue, I would like to tell you about Right Place. Right Place Health Initiative is an indigenous nonprofit organization on a mission to uplift rural communities by providing access to quality health care, as well as fostering youth leadership and governance in Africa. The organization serves as a veritable forum for collection of ideas and resources aimed at improving socioeconomic health and moral standard of women, youth, and children. Basically, today we're actually talking about water, and we're talking about water, and this is the first edition of the water dialogue, the Right Place Water Quality Dialogue. And the major theme, the theme of the event is "We Are What We Drink," and we're going to look at the emerging advanced technologies for effective water treatments in the vanguard of alleviating waterborne diseases. And on this note, I would like to introduce our president, Dr. Mezie Okolo, the Chief Executive Officer of Right Place, to do his opening remarks. Thank you very much. Dr. Mezie, over to you, sir.
Very much, everybody, for taking the time to honor our invitation. My name is Mezie Okolo. This is the first edition of our water quality dialogue, and we are hoping to have more of this dialogue going forward with stakeholders who have interest in the water quality space. I thank especially the representatives of the government who are with us today. And like the moderator said, Right Place Health is interested in what we drink. And right now we're talking about water quality. We have lots of other programs, but our focus now in this season since last month has been on water quality. We attended a conference last month in Kigali, and we talked about the SDG number 6, if that is achievable. And we also talked about neglected tropical diseases. So those were the two papers we presented. And today we decided to further the discussion and narrow it back home to Nigeria. We are what we drink. And we want to see how we can advance these discussions and build momentum that we need to be able to achieve the SDG number 6 and also improve the quality of lives of our people. So thank you again for coming, and we would like it to be very participatory so that by the time we go from here, we go with a renewed strength and vigor to continue to fight and to advocate against waterborne diseases. You're welcome.
Thank you very much, Dr. Mezie Okolo, our Chief Executive Officer. To move forward in this this dialogue. Our first speaker today is the Honorable Minister of the Federal Ministry of Water Resources and Sanitation, Engineer Professor Joseph Talumin Otav. I beg your pardon. FFNSE, FINCE, FNIWE, FICEN. Ably represented by Mrs. Elizabeth Ugo, Director of Water Quality Control and Sanitation, Federal Ministry of Water Resources and Sanitation, Abuja. Mrs. Elizabeth is going to be speaking on the effective public-private partnership for the supply of safe, clean, and hygienic water. You are welcome, Mrs. Elizabeth Ugo. You can unmute yourself, ma, if you're here. You can hear me. Yes.
Yes, thank you, the MC or moderator. Thank you very much. And I also thank the organizers for inviting us as a ministry to be part of this discourse today. I greet the Chief Executive of the Right Place, Ms. Yokolo, and everyone present here. Good afternoon. So like the moderator said, I'll be speaking on the effective public-private partnership for safe water supply. I think you have the presentation. Are you showing it? Hello, can you hear me? Are you showing the presentation?
If you are ready, okay. If you are ready, we will put on your presentation, ma.
Yes, please. Like the moderator also said, I'm sitting in or standing in for the Honorable Minister of Water Resources, Engineer Professor Joseph Youssef, to speak on the effective public-private partnership for safe water supply in Nigeria. Could you please put the presentation on?
Okay, ma, just in a few minutes, a few seconds, sorry.
Okay. All right, thank you. So for the presentation, anyway, let me go on before it comes on. We'll be having the outline, looking at the common sites we have across the country. We'll be looking at the water quality where in place of in SDG, overview of safe water supply. We'll also be looking at drinking water services, the ladder, according to the GMP UNICEF. And then we'll also be looking at the Nigerian drinking water quality status, what we have in Nigeria, going by our national survey, the WASH norm survey for the ministry, the national outcome routine mapping. We have in the ministry an annual survey that we do to be able to track what we have, achievements, progress on the SDG 6. And then we're looking at some challenges in the sector, in the management and provision of safe water in Nigeria. And then the ministry's interventions, way forward, and then conclusions. That is what we'll be looking at. I'm still waiting for the presentation. Do I go on?
Okay, ma, you can go on while we sort out. We have a little technical issue here while we sort out your presentation, ma.
Okay.
It will come in a minute.
Because of time. So normally, if we are looking at water quality, the usual picture we have in Nigeria, you see maybe like we say, water is life. Yes, water is life, but water can also be dangerous. Why will it be dangerous? When the quality is bad, when the quality of the water that we consume is not safe, that means it can be injurious to our body system, and that will affect and have impact on our health. So normally you see they say water no get enemy, or we have been drinking this type of water ever since, no matter how colored or turbid the water may look, and they feel safe to be drinking the water. You know, they say water, my grandparents have been drinking this, but these are dangerous sources that people take from, and without any treatment whatsoever, it's a risk. You see, like the Meruas that they fetch the water, by the time we do the analysis, even from our reports that we have done, most of the water that they are delivering to people are already contaminated. You talk of bacterial contamination, you talk of the chemical contamination. They are there in the water, and this is injurious to human health. And then when we talk about the SDG 6 as we relate it to water quality, just like the chief executive said, the SDG 6 is the one that speaks to water, clean water and sanitation, that's ensuring availability and sustainable management of water and sanitation for all. Then when we look at the target 6.1, that is by 2030, we are supposed to achieve universal and equitable access to safe and affordable water, drinking water for all, while the target 6.3 speaks to improve water quality by reducing pollution, eliminating dumping, and minimizing release of hazardous chemicals and materials, and be able to have the proportion of untreated water to be able to be sure that what we recycle is safe for use for the populace. Then if we look at taking an overview of safe water and trying to define some terms, when we talk about provision of water, we are talking of that to by public utilities. That's the state water agencies that provide water, that's pipe water now, to the populace, to the people in the communities to be able to have water, even though now in most states in Nigeria, that is no more existing. And those who even have the capacity is very low, that they are operating below capacity. And that also speaks to the fact that there's no guarantee that there will be safe water to the populace. Then you have also commercial organizations that are involved. You have private vendors, like those who have the tanker providing water for people. You also have the Meruas. I think it's common in our society that provide water. The safety of this water they are providing to individuals is also questionable. There are community endeavors, community efforts, like some will say that we are our own government, providing water for ourselves. As a ministry, we intervene in the supply of water, but the main responsibility of provision of water lies with the state government to be able to provide safe water through their state water agencies or water corporation to the populace. But sometimes, you know, there are other private organizations like private enterprise also involved in providing water for themselves, and then private commercial enterprise that are involved in provision and for a fee to be able to provide water. We talk of the quality of water, we'll be looking at chemical, like I said before, we have the chemical, physical, and biological characteristics of water based on the standard of its use, because we have the standard of quality for drinking water, the quality for irrigation purpose, the quality for tourism, that is maybe for the swimming. There are different standards that should be used, but I think more here will be concerned with the drinking water. When you said with the theme of this meeting that you are what you are what you drink, so that will tell us you are what you drink. I'm about the fifth slide now, slide number 5, going to slide number 6. So we look at going to slide, okay, slide number 5 still. Slide number 5, thank you. Then, like I said, to the SDG 6.1.1, the indicator tells us the proportion of population using safely managed drinking water service. And what is safely managed drinking water service? We mean water from improved source located within the premises and available when needed and free from fecal and priority chemical contamination. There should be no chemical contamination, no fecal contamination, which will come, mostly we'll be talking about bacterial contamination. Then water contamination sources can be from industrial pollution, poor sanitation practices when the places are not kept clean or tidied, discharge of raw sewage without any form of treatment. Then solid waste dump, of course, leaches from refuse that are dumped in, and then oil spillage. Unsafe water are also issues about this are growing concern to the populace. Then we have also that, there's a human right to supply of water. Human right, that is that as individuals, as community members, they have that right to the supply of water. Governments are supposed to make water available to the people, safe water available to the populace. Then looking at the water supply, drinking water supply service chain, there's like the grading, the different categories we have. We have these those who drink using sources from rivers, dams, lakes. That is from our survey. We have 11% of the population. Then that's the slide before this, slide 6. Yes, thank you. So for unimproved, that is those who use unprotected wells, slide 6, or unprotected spring. And that is about 14% of the population. Limited, we have 8 of our population. Those who the distance is more than 30 minutes where they get improved water source, probably from boreholes or from hand pumps. Then you have the basic, and the basic is like talking about the MDG, because that's where the MDG stays. And I think that is where Nigeria is actually just having some half of the population, more than half, a little above half of the population having basic water supply. And then we have the safely managed, which is what is the SDG standard, but we are very far from that as a country. And that tells us also the type of water or the quality of water that our people are drinking. We just have 13% of our population with safely managed water supply service. Then when we look at the status of our water supply, we will see that, the statistics are really worrisome, because you see that at the source of water sources, all sources, we have that from the statistics we have from our survey, the WashNorm survey, 2021, 68% of water supplied at the source is contaminated. That's with bacteria, while just 32% is free from contamination. Likewise, at the point of consumption in homes and individual households, you have that 70% of the water that is consumed is contaminated, while just 30% is what is not contaminated. We also have the statistics to show the level or the load of contamination of E. coli, that is the bacteria in drinking water, which is shown there on the right side of the slide. And we have nationally that most of the water that is supplied, it's contaminated. When we talk about the national level, we see that at the source, we have just 32% of the water that is not contaminated, while at the household, that is nationally, you have 30% of the water that is not contaminated. So same figures, we have the figures for urban area and the figures for the rural area, where in the rural, you have 30% of the water is free from contamination, and at the household, 25% is free. So you see that most of what is taken, 75%, it's contaminated water. Same, we still have the statistics showing the quality of improved drinking water at the sources. We find that more than half of all our improved drinking water sources are supposed to be improved, but they are all contaminated, probably due to several reasons: the sanitary of the area, the means of the supply to the people, and even the same thing in the household. You have to do the different form of facility types, talking of from the public utility, from the taps, from hand pumps, from motorized hand pumps, dog wells, springs, and then rainwater harvesting. There are various degrees of contamination from these sources too at the household, which we see is quite worrisome. Then the challenges we have when it comes to provision of water, we have it that about 2.331 million of our people estimate. We have 2.31 million estimated water points that exist in Nigeria. And also looking at the water facility construction, 81% of the water points are constructed by non-government actors, while we have 75% of our water points that are self-supply. Like I said, it's not just the government providing. We have individuals also who provide water, and then there are private organizations, private enterprise that are also involved. But in all these, the challenges we face, some of what we see is that the infrastructure deficit due to declining investment in water supply. This is where we really need the private sector to come in, because it's not something that the government alone can do. Government alone may not be able to do it. We need private participation. We need the participation also of the philanthropists, of individuals, to be able to have and achieve the SDG goal of clean water and sanitation for all by 2030. Deficit, we said, in infrastructure. Infrastructure they have right now on ground, most of them are moribund, most of them need repairs or rehabilitation to be able to function effectively. So these are issues and challenges. And we talk of the infrastructure, apart from being deficit also, the population that have to be supplied or have to be served has increased so much that the investment in infrastructure needs to be tripled to be able to meet up the provision of safe water for our people. We have poor water quality regulation and enforcement in place, public utilities and private water vendors. There's poor water. The regulation is not like we have our Nigerian drinking water quality standard, but the enforcement of that standard is something that we are yet really to start working on, to be able to enforce, starting first with the state water agencies, to be sure that what they are providing to the people clean water, safe and clean water. And as a ministry, we try to do our surveillance, do remedial actions, recommend remedial actions for state water agencies to be able to meet up to the standard and comply with standard of parameters that is required for safe water supply to the populace. Then we also have inadequate skill capacity, not just now talking about looking at the national, but we're looking at the state levels. We need more skilled workers to be in the field, to be able to support and also give the advice, do the surveillance and advice where necessary to state water agencies, particularly at the state, because the real implementation is at the state level. So we need this capacity at the state level to be able to do the relevant and necessary treatments before the water is being pumped to the people for consumption. On slide 10 now, the ministry's intervention. Slide 10, the ministry's intervention. So as a ministry, at a point, the statistics we had, even there was a survey by the World Bank, we realized that the percentage of piped water to households has decreased. In the 70s, it used to be like about 70%, but at the time a survey was carried out by the World Bank in the, I think, 2018, it depreciated to 17%. You now see that the percentage of households that get piped water from the State Water Agency reduced to 17% from about 77% in the 70s. And so this call for action, and that from the ministry and the president declared a state of emergency in the WASH sector. And then the ministry responded by the launch of the WASH National Action Plan to be able to address this emergency, including the poor water quality indices we have. And then there were construction of water supply facilities and training of communities-based facility managers, so that like the WashCom in the communities, they are able to talk to them. We have programs like the water safety planning, community water safety planning, to be able to sensitize members of the communities on how to handle their water and have it safe at the point of consumption. Then there's the establishment of the water quality monitoring laboratories. For now, the ministry will have 8 functional laboratories spread across the country to institute water quality monitoring, so that points of pollution can easily be identified and then remedied. We also launched the National Roadmap for Water Quality Management recently in the ministry. We rolled out the Rural Drinking Water Quality Monitoring and Surveillance and development of strategies for water safety planning, because we felt that the issues of water quality needed to be brought to the burner, and for sensitization, even at the community level, for people to take these issues seriously. Because like we know, water safety or water resources, if we have the safe water on sanitation, it is preventive health. So to have a good system, to have humans and persons that will be healthy to do their work, it's good that the water interest and importance should be attached to the water that is being provided for them to drink. Then we also institutionalized the WASH norm annual survey and scaled up the WASH information management system. This is the WASHIMS, which we call the WASHIMS. These platforms will help the ministry to be able to track progress and attainment of the SDG 6 in the country. We also had the establishment of the coordination group. This is a collaborative group that speaks to water quality issues from different spheres, different agencies from the private sector, from government agencies, and private individuals, the academia. They are all parts of this group to be able to discuss issues on water quality, management of water quality in Nigeria, so that we can be able to make positive impact on the populace. Then we look at the next slide, improving safe water. So what's the way forward? In all this, we have seen the problems, we've seen the attempts of the ministry in making sure that water quality is brought to the burner and water quality issues are made to be important, to have impact in the community, and hoping also that at the subnational, they will follow suit to be able to take up the issues of water quality to supply safe water to their populace. So the way forward, we believe that ensure high level of political buy-in, particularly, I say again, at the subnational, because the implementation is at the national and their main responsibility of provision of water to the populace is at the state level. So we need to have the state, the unfortunate thing is, like, when you talk of water quality, it's not something you can really see, but it's something that has impact. So that is where the issues of water quality is. It is what we need for state governments at the high level to be able to have interest in this and also work through it. Then improve investment in infrastructure development. We have said that there's a deficit, and so we need improvements in that area. Creating the enabling environment for private sector participation. Private sector participation as it comes across the chain, even as it's talking about water treatment, water supply, we need the private sector to come in to participate, to support what the government is doing, and also like their social corporate responsibility. They can also be able to do that. We need also to strengthen regulatory frameworks for safe water supply. We need to strengthen capacity of the public and private service providers. We need to do some sensitization to be able to let them know the essence and importance of the process of supplying water should be made so hygienic so that at the end, the water that is being produced is safe for consumption. And we need also to implement water safety plans at the national level, at the state water agencies and in communities, because the communities also have their own supply that they do. So we need to educate them. We need to sensitize people on the way to handle their water from source to the point of use in their homes so that they will be able to keep the water clean for consumption. In conclusion, to summarize all that has been said, we need to put in place some strategies, like as for government, to have the enabling environment for public-private partnership, because like we know, and what the trend these days globally, the government does not do this alone. It's now you need to involve the private sector, bring in the private sector to invest in the supply of safe water to our people. We implement policy recommendations to deliver safely managed water to rural areas, small towns, and peri-urbans. The goal of the SDG is safely managed sanitation, but most of what we are doing in Nigeria is basic, and we are hoping that before 2030, we'll be able to have a higher percentage of safely managed water supply in the country. Then water safety plan, this should apply. This is the comprehensive risk assessment and risk management approach, so that when water is supplied at the state level and at community level, and individuals in their homes will have that sense, will have that education that they need to keep the way they handle and process their water, so that at the point of consumption, the water is still safe and bacteria or harmful chemical free for them to use. Then we also need the health-based guidelines and regulations. We have some guidelines already, like I mentioned before, for rural water quality monitoring to be able to guide the people in the communities. And we'll need also to promote health-based regulations where the environmental health officers, like we used to have, will be able to go and inspect and make sure that the source of water, like we have, that's the facility now, talking about the facility, the boreholes, the taps, that the surroundings are kept clean, because contamination will come from dirty environment where you have a tap or where you have your point of water facility. If the environment is not kept clean, it's a problem. And with things like open defecation as well, these are the things that can lead to contamination of our drinking water. So efforts will be made in sensitizing, we do that, sensitize people on how to use the toilet and not defecate in the open, so that our environment will be kept clean and healthy, so that we also have healthy populace. So in all, we need to remember that collaboration by all relevant stakeholders is key, because to have a safe water supply, it involves a lot of, it concerns me, it concerns you, it concerns various individuals. It's not something we leave to an entity, or it's government's role, or no, we all have a role to play. So as stakeholders in our different spheres, it's important that we collaborate, let there be transparency, we have our clear roles, play our part for the success of a successful public-private partnership in safe water supply management. And by this, we contribute to achieving the SDG 6.1, talking about supply of safe water, which aims for universal access to safe and affordable water for the well-being of our populace. I think that concludes it. Thank you for your attention. I'll be around to answer questions, and I think some of our team, they are also here if to be able to clarify if there is any need for clarification and answer questions. Thank you so much, and thank you for inviting the Federal Ministry of Water Resources and Sanitation to this meeting. Over.
Thank you very much, Mrs. Elizabeth Ugo. I must say that this has actually opened our eyes to a lot of things the government is doing and what we need as a people. I would take, there are some keywords I must mention, which is collaboration and sensitization. And collaboration and sensitization. And I must say that at Rite Place, we're looking forward to, to join hands with everyone, all stakeholders, in making sure that we have clean water, which will even help to eradicate waterborne diseases. That being said, thank you so much, Ma. And just like she said, for those that have questions for this particular session and other people that will speak, you can put your questions on the chat box. We'll be able to lift it from there. And also believe, Ma, that you will still be around to answer this question. And I want to apologize for, to people because say that the time of our time management, and I believe that our next speaker will help us to.
Okay. Sorry about that. Yeah,
yes.
Sorry about that.
So I believe our next speaker will help us to manage time so that we will leave here as soon as possible.
Wow,
yes,
sorry.
Ma. Thank you so much, Ma. And I believe that everybody hearing this will, put hands together, work with even the government, partner with the government and stakeholders. And of course, from Rite Place Health, we are ready to collaborate with anybody in this aspect. And that's why we are here. Thank you so much, Ma. Our next speaker would be Professor Moji Adeyeye, the Director General of National Agency for Food and Drug Administration and Control, NAFDAC, ably represented by Mrs. Loputaife Adora, Vivian, Assistant Director, Food Safety and Applied Nutrition Directorate, FSAN, of the National Agency for Food and Drug Administration and Control. Mrs. Adora will be, giving us guidelines for effective water treatment in Nigeria. And I will say, if you are here, Mrs. Adora, you can unmute yourself and go ahead with the presentation. I also want to beg you, please, let's make it concise so that we can leave early. Thank you very much, Ma.
Okay, thank you, everyone. Thank you and good day. Can you hear me? Can you hear me? Can you hear me? I've unmuted myself.
We can hear you.
We can hear you.
Okay.
We can hear you.
Okay. Thank you for having me. It's a pleasure to represent, it's my humble pleasure to represent my Chief Executive, the Director General of NAFDAC. And from her message, he sends you great thank you to the Chief Executive of Rite Health Water and your entire team and all the people on board. Without wasting much time, I am going into the training or the lecture on guidelines for effective water treatment in Nigeria. It's a pity that the time is very short, But the outline goes, the mandates, NAFDAC mandates, you can continue. After the NAFDAC mandates, we now enter the background, why effective water treatment in Nigeria is paramount. We now see WHO definition of drinking water and NIS standard for water. That is Nigeria Industrial Standard for Water Analysis. Then types of water treatment, conclusion and references. Our mandates, you can be moving. The National Agency for Food and Drug Administration and Control, NAFDAC, was established by Decree number 15 of 1993, as amended by Decree number 19 of 1999, and now the NAFDAC Act-Cap N1 Laws of the Federation of Nigeria, LFN 2004. We are to regulate and control the manufacture, importation, exportation, distribution, advertisement, sale, and use of food, drug, cosmetics, medical devices. We are now in packaged water. So according to, you are fast. All right. The background is, according to United Nations, 2.2 billion people globally lacks safely managed drinking water. In Nigeria, the use of contaminated drinking water and poor sanitary conditions result in increased vulnerability in waterborne diseases, including diarrhea, typhoid, and all other ones, which leads to the death of more than 70,000 children under 5. One of the 17 Sustainable Development Goals, and that is number 6, is aimed at addressing the challenge above by ensuring availability and protection for all. So our colleague, the first speaker, have talked specifically on SDG goals, and I just want to mention it, and since she has mentioned a lot on it, is to ensure availability and sustainable management of water and sanitation for us all. We are hopeful that according to this, that by 2030, that the SDG will need to have a safe drinking water for all of us, for both those that are in urban and rural areas. Then the WHO definition of drinking water and NIS standard. It goes, WHO defines drinking water as water that is safe for human consumption without risk of adverse health effects. It should meet certain standards for quality, including the absence of harmful contaminants, clarity, and palatability. NIS standard for water says that water focuses on establishing criteria for quality, safety, purity of water for various uses. It outlines parameters such as microbiological, physical, chemical characteristics, and that water must meet to be considered safe. NIS standard, Nigeria Industrial Standard, that's the meaning, are designed to safeguard public health and ensure the reliability of water for domestic, industrial, and other purposes. Adherence, when we adhere to NIS standard, is essential to promote consistency and quality across water sources in Nigeria. We are now in water treatment. Water treatment. When treating water, several factors need to be considered to ensure effectiveness. And safety of the treatment process. Here are the key factors to take into account. We have water quality analysis. This is the analysis of raw water whatever you want to do, you must test the raw water. That raw water will give you the insight of what you are going to treat, because we have different places, and that is why we need to test different water. The water from Abuja, certain places in Abuja, may not be the same in analysis with water in Lagos, especially in our island, where we have the Atlantic Ocean close to us. So you will need that analysis of raw water first before you start treatment. Then sources of water, we have the public mains, we have the rivers, stream, borehole. Then water usage, we have the drinking water, we have the industrial processes, we have water for agriculture, water for recreational purposes. And this determines the type of treatments that you are going to give to that particular water product. Regulatory standard, the NIS standard and NAFDAC standard guidelines is what we can follow to get what we want. Next, okay. Portable drinking water system are different water treatment methods to provide safe drinking water for our communities. Facilities that produce potable water often use a series of water treatment steps that include coagulation, flocculation, sedimentation, filtration, and disinfection. As part of strategies by NAFDAC in achieving its mandates, regulations and guidelines are put in place to ensure effective water treatment for packaged water in Nigeria. Next slide. Next slide, please. Okay. Why I want us to look at this, these are the NIS standard for parameters that we need to check in water. I will just mention by few. Iron. There are certain places that when you drill your borehole, you notice that iron is so high in that water. And what we are looking at, if we are looking at the presentation, you know that iron should not be more than 0.2 milligram per liter. Also the nitrates. And the one that is most paramount is the pH of water. The pH of water should be 6.5 to 8.5 because we are not supposed to take acidic water. Any water that is below 6.5 is very acidic and is injurious to health. Next slide. Treatment process in water. NAFDAC guidelines. The guideline prescribe the minimum good manufacturing practice requirements for the facilities and controls to be used in the processing of water to ensure that it is safe and meets quality standard. In the guideline, emphasis should be given accordingly. Organization and personnel, hygiene and qualification. Personnel, for somebody to be your production manager or for you to work in water board, you're supposed to be a science-based, you're supposed to have a science-based qualification, OND, HND, BSc, so as to know the chemistry part of what we are dealing with. Then building, the location of the building and the building design. In location of the building, the facility should not be located close to a dump site. It should not be located close to an abattoir, close to a cemetery, and close to any products like hazardous products like cements that will be a contamination to the water. It should not be located towards that. And the design of the building should have at least a minimum of 4 rooms. Like when your officers come to work, they will go and change. That is the cloakroom. Then where you have your packaging material, if you are producing PET bottle or sachets, like it's supposed to be separate and under the UV lights for treatment. Then from there to the production place, from production place to finished product place. That's why we are putting it as at a minimum of 4 rooms. Then the equipment, nature and design. We need to have an equipment like a stainless steel or PVC tanks that you know that it will not cause harm to your product. Then the treatment process. The next slide. Next slide, please. These are the main treatment process we have in NAFDAC and generally. Globally, we have disinfection, we have filtration, and we have sterilization. I have to explain it briefly. Disinfection, next slide. Disinfection, the appropriate method of disinfection such as chlorination, where you can use your chlorine with a minimum and maximum of 2 to 4 parts per million. We can use reverse osmosis is a machine and it's very efficient in water disinfection. Ozonization is part of it and should be applied. This chlorine compounds to the water to kill or inactivate bacteria, viruses, and other microorganisms. That's why a lot of people today steal chlorine. Ozonization, ozonation. The use of ozonation is a powerful oxidizing agent. It's equally used to disinfect water by destroying the bacteria, viruses, and other pathogens that can cause illness to us. Chlorine dioxide treatment. The application of chlorine dioxide is an effective disinfectant to eliminate a broad spectrum of microorganisms. Next slide. Well, I can continue. Next slide. We are going into filtration. This process is achieved by passing the water through a sandbed filters and then through activated carbon filters. We are doing this to remove the excess chlorine that we use in the beginning, then, and is equally used to remove color if there's anything, odor, and taste from the water. If we can remember our primary and secondary characteristics of water, water should be colorless, should be odorless, and it should be tasteless. So, reverse osmosis, a membrane filtration process that removes contaminants, including microorganisms, by forcing water through a semi-permeable membrane. Sterilization, that should be the last water treatment and is in the next slide. Sterilization in the next slide. It can be achieved by passing water through appropriate UV sterilizers. The same thing is to kill off any other microbes that may have escaped the disinfection stage. Then, the next slide. The next slide is an overview of our water treatment flow diagram. An overview. This is where most of us can pay a little attention. First of all, the borehole. The borehole of the water, the minimum should be 150 feet. It depends on where you are drilling your borehole. And it all depends whether the place is densely populated. When the place is densely populated, you now know that the aquifer need to go prior inside deeper, and that you can go maybe like 200, 180, 200, and 250. So public mains, spring water, these are the places that you can get your water. Then another one is from there, it goes to the raw water tank. This raw water tank, some use it as a sedimentation place, some use it as a treatment module place. From there, after the treatment, it may stay for 24 hours. Then you should now move them to the sand bed filter and the activated carbon. From activated carbon, at this particular point, it removes the excess chlorine, remove the color and other things. Then treatment water, treated water should enter into the PVC or stainless steel tanks if you can afford it. That is the best. Then the other one is microfilters. Microfilters, you go through 5 micron, 1 micron, and 0.5 micron, which is the least and the tiniest. After that, if you still wish to, you are suspecting that your water should be further treated, you add the UV sterilizer. And this UV sterilizer, we call it the CCP, which is the critical point. If water is not well treated at this place, then you now know that it will not go into, is either you are using a bottle or using a sachet. So that's why you can add that sterilizer for the last time. So at that point, if the product is packaged in bottle or sachet, you now know that the water is fit for consumption. Then in conclusion, the next slide. In conclusion, if water treatment is not effective, it will impact on public health, leading to waterborne diseases, which we all know, like typhoid, like cholera, scabies, worm infections, hepatitis. And that is to tell us that we are what we eat. To ensure that water is safe and effectively treated, food handlers' tests must follow the rules of good hygiene and safety at every stage of food handling. Food handlers' test is your staff that are working with you or people at the water board that are doing the treatment should test themselves at hospital, government hospital, to make sure that they don't have typhoid, they don't have cholera, and so that they should be able to work for us and give us good quality water. In order to boost the country's economy and reduce the menace of waterborne diseases, both the government, the industry, the regulators, and the general public must play their respective roles to ensure reduction or total elimination of unclean water within our food system. Let us join the SDG goals to say by 2030, we will all join to give our people safe water to drink. These are my references, and if you can equally go to our website for more. Thank you for having us. Thank you.
Thank you very much, Mrs. Ilopotaife Adora, for this wonderful presentation on the guidelines for effective water treatment in Nigeria. This has actually put my eyes to, I'm sure, even participants on guidelines on how, on water treatments. The keywords that I was able to look at was water quality analysis. You talked about water treatment and also the source of water, and these are things people at Right Place Synergy, there's a lot. I believe our CEO is going to also, talk about, these areas. So without wasting our time, we have questions here, but I believe based on our rules on this particular call, and these questions will come up after the last presentation. Madam, I will also want you to stay around so that we can answer these questions. Next is our CEO, Dr. Chukwumeze Okolo. He will be making a presentation on driving innovative technologies and solutions for water treatment in Africa. Join me to welcome Dr. Chukwumeze Okolo, the CEO, Rite, please. You can unmute yourself, sir.
Okay. Thank you again. Hope everybody can hear me. Can you hear me?
Yes, sir, we can hear you.
Okay. So I'm talking about, thank you the two last speakers, Mrs. Hugo and Mrs. Ilopotife. It is important for us to have meetings like this so that we can synergize and work together to achieve the result that we all want. From the presentations I could see, both speakers highlighting areas of need, and everybody can see that what we're discussing today is very important. Water. Everybody drinks water. And so without wasting much time, I'm going to be talking very quickly to the slide that I have prepared on innovative technologies and solutions for water treatment in Africa. But today I'm going to be narrowing down to the technology that we promote in Rite Place. Of course, everybody knows the importance of water. Everybody drinks water. Like I said, water is good, is an element of life. So our body has 75% of our body is composed of water. And people can go without food for days. But if you go without water, you risk dehydration and a lot of impact on the body biochemical system. As much as water is important for adults, even in children, it is more critical. And so it is important for us not just to have access to water, but to have access to quality, clean water, hygienic water, water that is safe for drinking, and water that is free from contaminants. Next slide, please. So access, I think it was the first speaker that talked about how access to safe water is a right. It's a fundamental right that government should provide access. Now, government cannot, in places where government cannot provide access, there has to be, all hands must be on deck to be able to achieve results so that we leave nobody behind. We're talking about SDG number 6 for 2030. Like I mentioned, I alluded to before, one of the questions we were asking at the last conference we had was, is SDG number 6 achievable in Africa? 2030 is already around the corner. How far have we gone? And what do we need to do to be able to guarantee access, especially to the poor that are left behind always in Africa? So, and this is important. Even now, people are beginning to wonder if 2030 is achievable. Now we're talking about Vision 2063, the Africa we we need and the Africa we want. So even by 2063, if we continue to go at the rate we are going, given the issues that we have highlighted, are we going to achieve access to water, clean water for all? Think about it as we continue our presentation. Now, you notice that even the water that you buy, the bottled water that you drink, the sachet water that you buy, how clean are those? I mean, even the ones that the names that you're supposed to trust. And of course, you know, in Nigeria, everybody, most of these water sellers have NAFDAC numbers. Some of the NAFDAC numbers manufactured behind their clothes, their kitchens. And so people are not even able to have a way to figure out which ones to trust. And this is part of our story that led us into this vision to lend our voice to the water quality in Africa. Next slide, please. So 80%, more than 80% of the diseases we have in Africa are water related, literature said. So, and more than 50% of Nigerians don't have access to quality water. These two issues are of concern to me. If more than 50% of our people and more than 80% of the diseases that we have are related to water, bad water, poor quality water, then all hands must be on. Waterborne diseases are on the increase. Under 5 mortality, infant mortality, when you look at the statistics in Africa, they are alarming. Diseases that are long forgotten in the West are still prevalent with our people, especially the poor in rural places. Even from the water that our people drink. When the last speaker was talking, she showed us the percentages that are allowed of chemicals or impurities or contaminants in the water. But when you actually test the water that our people drink, you see high levels of chlorine, high levels of bromine, high levels of fluorine, and even some elements that could also have potential carcinogenic effects. And people are exposed to these things on a daily basis. Sometimes people don't even look at know the standards, not even the guidelines, let alone abide by them. And they get away with these things because, of course, it's difficult to reach everywhere. And even as hard as the regulators try, it's difficult to be able to reach unless all hands are on deck. And this is part of why we're calling for these issues, for us to all come together and work together. Next slide, please. Next slide, please. The bottled water company business in Nigeria, of course, has been on the increase. Everybody is bottling. It's even more concerning that people are bottling from their kitchens. They sachet water. But we see that the business is really growing. The need for water is also increasing. People are drinking more water. People are needing more water. And even though sometimes we have chosen to drink Sprite instead of water because we couldn't trust the quality of the water we were given. But the question is, at the rate we are going, given the doubt and the question around the quality of the water that we have, what can we do as a people to improve health through the quality of the water that we drink? Next slide. Now let me talk about the emerging technologies. a water treatment. The last speaker spoke about the stages of water treatment based on NAVDAC guidelines. We heard about filtration, we heard about ozonation, we heard about reverse osmosis. With those in mind, you see that all of those are different advances in technology trying to get the quality of the water that we drink to a level that will help improve public health and prevent waterborne diseases. In recent years, efforts have been made in different places to try to establish the cost-effective ways to be able to achieve these results with minimal side effects. Of course, if you have a good system that people cannot afford, it is useless. Because what use is it when the people cannot afford either to install or to maintain? But nanotechnology has shown some improvement and some promise in advancing the discussion around water treatment, as well as ozonation, which also she mentioned. You remember she mentioned filtration and she mentioned ozonation. And those are the two that the system that we promote and that we with the people that we partner with are promoting. And these technologies have of nanotechnology and ozonation have shown advantages in several places to be able to advance the cause of water quality and to ensure access to clean water. So we'll be talking about nanotechnology and ozonation. Next slide. Nanotechnology has many applications in the present day advancement in science and technology, in medical field, in the energy sector, in the environmental remediation, and also in water treatment. So a company, an American-based company, Phoenix, had patented a formula, a technology based on nanotechnology and ozonation. And in our search for an effective solution that will be available and affordable and durable within our system, we partnered with them to be able to make this available to our people. Next slide. In this water treatment using nanotechnology and ozonation, nanofilters are used. Time would not permit us to go into all the details with nanofilters, ultrafilters, and all those filters that are, and even the reverse osmosis. But nanotechnology, nanofilters have shown a lot of advantages in how it leaves the water after treatment. Of course, it's able to eliminate viruses, bacteria, suspended solids, ions, dissolved ions, both organic and inorganic, chemicals, heavy metals. And the last speaker also talked about heavy metals in some areas like in Lagos. If you fetch water and leave it standing, by the next day your water has turned brown. So nanofilters have great efficiency when you compare with microfilters and ultra filters, and it has low energy usage. Now, nanofilters also is a pressure-driven membrane separation process, and so it is very energy efficient, it's sustainable, it's affordable, and it can address the problems of turbidity, microorganisms, and some dissolved contaminants. Next slide. With ozone, which is O3, it will be eventually oxidizes to oxygen. So I think it was the last speaker as well that mentioned ozonation, which is able to oxidize and break down even microorganisms, contaminants in the water. And then at the end of the day, the ozone is, it's an unstable O3, comes down to oxygen. So it eliminates the possibility of contaminating water with, for example, chlorine that is supposed to even, clean it. So when you use chlorine and you don't use at the right proportions, they maintain the correct parts per million, there are consequences to that, health consequences, which we are also a little conscious about. Now, the oxidative property of ozone is widely documented, widely researched, and widely known. And time will not permit us to go into the details, but suffice is to say that at the end of the day, ozone and the ozone generators have become top in the ranking of things with water treatment lately. Now, our partners, the Phoenix, also have their own patented ozone generator, which is also available and which is affordable and which has been guaranteed durable. And this is why we like them. Next slide. Next slide. So through ozonation, the system is able to give you water that has the right turbidity, tastes right, no odor, like the physical properties and the chemical properties of the water that you get at the end of the day is guaranteed. Then of course, when you even add any UVs to it, it's like a doubling the guarantee at the end of the day. So when you get rid of parasites and all the E. coli in the system, viruses and bacteria, the dissolved chemicals, heavy metals, what you're looking at now is water that you can take to town. Next slide. We call this water quality solution package powered by Phoenix. And so our idea for partnering with Phoenix is based on the use of ozone and the nanotechnology. Now, this system utilizes quantum disinfection coupled with nanotechnology. And this quantum disinfection is a revolutionary technology, which is the same principle that you use in quantum mechanics and that you see in smartphones and computers. And so this patented technology, this technology was patented in the US. It's approved by the FDA and is EPA certified. under finance. Again, basic operation is water filtration and water purification. And every system that has to guarantee quality water has to go through these two processes. Now, the filtration part removes all those sediments, and the filtration part removes the rest of microbes and dissolved elements to give us a finished water that tastes good and meets the quality standards. Next slide. So based on the volume of water that we expect to use, we can decide which package will be good. The last speaker again also mentioned how you have to do the initial water analysis. That's also what we do in Rite Place. We have to do the initial water analysis to be able to determine the contaminants in your water before we then customize the treatment that will address that without really overkilling it. So if the water in Lagos and the water that you see somewhere in Enugu and somewhere in Nightmare and the water you find somewhere in Benue State are not the same. All water are not the same. So when water is analyzed, the contaminants in the water will now determine whether what to be customized to address that water. Of course, most people know that the water in Abuja is harder than the water in my village. And so the treatment will vary based on those. And the Phoenix solution has that agility to address those. And this solution is able to eliminate 99.99% of the dissolved contaminants, bacteria, microbes, and all those other contaminants that we don't want in the water, using all the nodes and microfilters that have been customized, both in the US and some components made locally. But also, more importantly, that system is able to remove total organic carbon, unlike ultra filters and some of your other systems that exist in the system. Next slide, please.
400.
Next slide. So three different options are promoted in their system. The first option is the small option that would just go to be attached to your kitchen. It's like a mini kitchen solution. Can I see the next slide, please? Good. So that system is attached to your kitchen, and then the water that comes from that particular tap is guaranteed to be of quality. Because if you look at the slide, you can see how we attach that along the nodes and the components along the water path leading to that sink, such that the water that comes there at every point maintained is clean and verifiable with a verifiable quality. But then we use that option mainly for when you don't have a lot, you don't need a lot of water, or if it is just for one space, for one unit, or for localized supply, then that will suffice. Because at the end of the day, the volume of water that is passing through the nodes will determine how much and how much barriers that you need to install prior to the point of use. Next slide. The benefit of that system is that you will not need to buy any more water, bottled water, or even sachet water. Of course, everybody knows, or rather, we should know that when we package water or even bottle water and store the water over time across distances in the hot weather and all of that, that the water that you now that was clean at the time of bottling and the water that you are drinking 2 weeks or 1 month or 6 months down the line is not the same quality. Again, each time there is contact either with bottle or with sachet or with whatever, then you still have to guarantee that there is no leakage of components from that bottle into the water. And we cannot guarantee this at every point in time. Next slide. The second option is the one that could be good for a household. So like a family unit, a duplex. That one is connected close to the water supply to the house. That it will be able to support that, so that every point in that house, including your shower, gets clean water. And this one will be a little more expensive than the mini kitchen unit, but it's still very much affordable. But at least it guarantees that every person within that house unit, or even a collection of flats in a house, maybe like a house of 4 or 6 flats, can have just one system like that installed around their water source into their yard. And this can supply that whole unit. A hotel can use that, a school, a small hospital, yeah, a shopping complex can use that. The only difference between this option 2 and the flagship option is the ozone generator. Meanwhile, remember that at first we still have to analyze the water and determine how clean or otherwise the water is. Then we customize those nodes that will be used to be able to treat the water and get the result. So if you look at that diagram, it shows you how the flow goes from the source, whatever the source is, and then how it goes into the ozone chamber, and then how it's pumped into the overhead tank, and at what point we intervene with the appropriate solution to be able to either filter or disinfect or sterilize or treat, be able to supply the water to the house unit. Next slide. The benefit is the same as the first. All is targeted towards eliminating water-related diseases. And it's very affordable. Next slide. This is the flagship. It gets a little more complex and a little more complicated, but it's just to show how we can move from a single unit to a multi-unit, depending on the volume of water that is being distributed. And so this one incorporates the use of the ozone generator. Ozone generators, and this one can serve for a whole community. So if we want to set up a water treatment for your village, this is what it's going to look like. And with proper maintenance, this is sustainable, it's environmentally friendly, and it will guarantee proper supply of water that we can drink. Next slide. Next slide. Again, the benefit of the flagship option is no need for sachet or bottled water or dispensers. everybody can have access to the same quality of water that you could get from any bottled water. So you can imagine the impact of such a thing in a whole community. Like let's say a community that has guinea worm. If we replace or set up something like this for a village where they have guinea worm, you can see a reduction. You will see an ultimately elimination of such a disease state. People can access clean water in a very timely manner. And this is an investment that individuals, philanthropists, politicians, even in their constituency projects, can execute without breaking banks. And instead of bringing people drugs or giving communities drugs when they're having diseases that are caused by dirty water, why don't we give them clean water and reduce the need for drugs? And the whole idea of this is that even if you choose to bottle it or to sachet it, whatever you decide to do, that ultimately people are assessing in real life, in real time, fresh water that is guaranteed of this quality. The impact on public health cannot be overemphasized. Next slide. These are some of the things that are included in the treatment. I wouldn't waste time on that. We already mentioned that the technologies in the past. And next slide. And these are some of the components of the Phoenix system that power our water solution and what they address. The different components. If you visit our office anytime, you'll be able to see how these things are set up and some of the operations of this. Next slide. And why did we partner with Phoenix? Again, remember I said that based on nanotechnology, we believe that is a forward-moving technology that is environmentally friendly, sustainable, and affordable, and is better than reverse osmosis. We also know that this is a patented advanced technology. It's FDA approved, it's EPA certified. And the notes are made in Nigeria. So, because part of this is to encourage local participation. If our people can be part of this, why do we have to import those notes? So that creates also jobs for our people. And because we want to make this available and affordable to our people. And we, as much as possible, get to where all of it can even be made in Nigeria. That would be awesome. Because the more people that can afford this, the more we can guarantee public health. So the use of ozone has been the gold standard globally. And the ozone generator is very reliable and affordable. So this is why we partnered with the Phoenix technology to be able to make this available. Next slide, please. Next slide. So 99.99% of solids and 99.99% of every contaminant in water is guaranteed using this process. Next slide. In conclusion, it is our desire, our mission, and our passion to see to the elimination of waterborne diseases in Africa. And we are committed to making this move and to working with every stakeholder to be able to see what we can do to make clean water available to our people. It is public health. It is our duty it is our responsibility, not just as government or as government people, but also even as citizens in the corporate social responsibility, as people who need to give back to their community, who need to give back to their people, as people who need to put their education and their knowledge to use to advance the cause of humanity. It is a call that we must stand and answer and be able to move the hand of the clock in the right direction. Together, we can do something in this space. We can fight waterborne diseases. We can leverage technology. We can leverage our contacts to make a difference. Next slide, please. Next slide. I put together a little poem to show how serious the matter we are talking about is. Death in the cup. Take a slide, take a screenshot of that poem. Look at it at your convenience. Think about it. And if you have any questions, please feel free to ask me. But if you don't get anything from all we are saying today, get this from us. Now, waterborne diseases can be eradicated in Africa, but we must join hands and make it happen. Rite Place is an indigenous NGO. We have different arms to Rite Place Synergy, Rite Place Health, Rite Place Research, Rite Place Farmer. And in Rite Place Health, we are promoting the cause, any cause and causes that help, especially amongst marginalized populations in Africa. And right now we are focusing on water. But Rite Place Synergy is also partnering with Rite Place Health to be able to advance this cause. And Phoenix has come on board to be able to help us be as our technical partners to be able to provide this solution. And we'll be more than happy to partner with anybody and everybody in making clean water available to everybody in Africa in our effort to achieve SDG number 6. Thank you very much.
Wow. Thank you very much, our CEO, Dr. Chimeze Okolo, for the wonderful presentation. I would like to tell all our participants that we will also send you copies of the presentations. You know, we have your emails for all those that registered for this call, and we'll send you all of that. And I want to actually, in a special way, thank our last speaker, who is not the least actually for his patience. I've seen him, you know, smiling all along. He's been paying more attention, and I was really happy, and you know, for his he was smiling, and I can see that. So let's welcome Mr. Daniel Sauka Audu, the AG General Manager, FCT Waterboard, ably represented by Mr. Mohammed Shehu, the Director, Quality Control, FCT Waterboard. He's going to talk about sustainable water treatment solutions. Thank you very much, sir, for waiting for a long time and listening to all our conversations here. And I believe, because we don't have a slide, and I believe that your presentation is going to actually lighten up the mood of everyone, as everyone will be focusing on you. So you can unmute yourself now as we wait to hear from you. Thank you.
Thank you for having me. Good afternoon, everyone.
Good afternoon.
My name is Mohammed Shehu. I'm representing my GM, Mr. Daniel Salka. Before I start, let me just apologize that for not making slides available. I was told that I was only going to be giving 5 to 10 minutes. So we felt that it was so short a time to prepare any slides. And secondly, like the saying goes, science is universal. The previous speakers have done justice to the topic. Everything we have been discussing since morning is just based on one primary objective: safe drinking water for consumers. Truly, like it's been emphasized by the previous speakers, good health and hygiene cannot be achieved without safe drinking water. The challenge globally is not often the availability of water, but rather how much of the world's available water is safe for drinking. Reports have shown that about 71% of the Earth's surface is covered by water. And out of these, only 0.5% is availably safe for consumption. So, and to add to this problem, factors like increasing population, urbanization, industrialization, and climate change continue to exert or increase the need for safe drinking water. These same factors, unfortunately, continue to affect negatively the quality of our water source. So there's this need to meet global demand for safe drinking water. And in order to meet these needs, we talk of water treatment. Now, before we go on, when we talk of water treatment, the design and the procedures to be adopted in water purification depends on the characteristics or the quality of the raw water, which are basically from two sources, either surface water or underground water. Here in the FCT Water Board, I will emphasize on the FCT Water Board what we'll do here. We'll try to maintain the standard that is being established by the Federal Ministry of Water Resources, which is known as the Nigerian Standard for Drinking Water Quality. Before then, we've always maintained a World Health Organization standard for drinking water quality. Now, our treatment procedures starts from the aeration. The objective here is to expose the water to more oxygen such that hardness ions are precipitated, and in addition to get rid of obnoxious gases. From there, the water goes into coagulation stage. From the coagulation stage, we move to the sedimentation stage. Both the sedimentation stage and the coagulation stage is targeted at bringing the turbidity of the water to the globally accepted level. Then, at this sedimentation stage, if your sedimentation is properly done, about 90% of your contaminants will have been gotten rid of, because the primary essence of doing the carrying out water treatment is to remove contaminants or undesirable compounds, or bringing them to the desirable level such that they do not pose any health hazards to consumers. So if your sedimentation is properly carried out, a lot of that objective will have been achieved. However, from that stage, we still move to the filtration stage, such that some stubborn elements that refuse to settle at the sedimentation stage are filtered off at the filtration stage. After filtration, we carry out what we call the disinfection. Disinfection is supposed to be the last stage of water treatment, but however, sometimes there is need for us to adjust our pH so that depending on the pH that we arrived at after filtration, if there's any need, we still carried out a pH adjustment. Then thereafter, we push the water out for consumers. Even after all these treatment procedures, we subject, of course, before we put them out, at every stage of water treatment, we carry out our water analysis. Such at the end of the treatment stage, we have to be sure that the water conforms to the national standard for drinking water quality before it is sent out. Even when we set out this water, we don't just sit down at the lab or at the treatment plant and assume that everything is okay. We still monitor the water to consumer endpoints. We have a monitoring unit that goes out periodically to go to some public, most especially public institutions like hospitals, schools, markets, and field houses. We carried out random sampling of the water just to ensure that the water gets to the customer as safe as we sent it out. So now, the topic given to me is how do we sustain water treatment solutions? Like I said earlier, the challenge is that there's global shortage of drinking water, good drinking water. So there's need for some modern techniques to be used in order to achieve this purpose. And some of these techniques that are used includes reverse osmosis, activated carbon filtration, charcoal water filtration, or ultraviolet purification, biosand and ceramic water filtration. So these are some of the techniques employed in water purification. But all these techniques are capital intensive. And there's need. But thank God, the just last speaker before me have tried to inform us some of these new technologies. We are now talking of nanotechnology to advance this course of water treatment. So some of these technologies are not just, they are capital intensive, like I said. There's need for us to research on an indigenous way that we can achieve this water for good drinking water. And to do this, we will have to put into consideration some factors such as whatever technology we are going to advance, it's environmental friendly, it reduces water wastage, it uses less electricity, it's easy to handle, maintenance parts are readily available and easy to handle. If these features, if we can have water treatment techniques with these type of features, I think it will go a very long way in improving the quality and quantity of water to the consumers. We here in Waterborne, we have this slogan because we belong to the African Water Association. We're active members of that association. There's this slogan that price and quantity can be negotiated. However, safety and quality is not negotiable. Over the years, for all the residents of the FCT, they will be us witness that what we know to do well is to give good quality water. We make sure that at any time, we don't compromise the quality of our water. And whenever monitoring team goes out and sees any contamination in any water, of course, we know that such problem is localized. Most often, such problems occur with consumers that have storage facilities. Over the period, they don't wash or disinfect such storage facilities. So whenever we detect such, we inform them how to go by disinfecting their water storage. So in summary, let me just say here that in order to achieve safe drinking water for the community, of course, for a prosperous, healthy, and hygienic society, we need safe drinking water. And I want to once again congratulate the organizers of this program for deeming it fit to invite us to discuss on such topic that is very sensitive to the health and well-being of our community. Thank you very much.
Thank you very much, Mr. Shehu, for the wonderful presentation. Price and quantity can be negotiated or is negotiable, but safety and quality are not negotiable. This is a very key word that we should take. It's a takeaway, in fact, because we need to know how safe the water we are drinking is. At this point, we actually spent a lot of time here, and we have quite a number of questions. I don't know if we are going to be able to answer all of them. And we have a question for NAFDAC, and I don't know if our NAFDAC, Mrs.
NAFDAC is still here.
Okay, well, there's quite a number of questions here, and they are directed to NAFDAC. And one of the questions from Habiba Edward, based on your presentation, the question is, must the building for a water factory stand alone in a compound? Must the compound be fenced?
Okay.
Can a factory be established on the ground floor of a flat or within a flat of building? That's one. That's another related one.
Okay.
Are there processes by appropriate government agencies to ensure that water from borehole dug by individuals in the village or communities, are there processes by appropriate government agencies to ensure that water from boreholes dug by individuals in the villages or communities meet the minimum standard of good water quality? So I would like you to answer this while the rest of the question, because these ones are related questions.
Okay, thank you so much. once again, we want to say that through our guideline, we have purpose built for a facility for water production and adapted. And once it's purpose built suitable for this facility, you don't have any issue. But when it's adapted is probably you have been living there, all this, maybe using a flat. If you want to use a flat for a production, food production, especially water or any food production, it must be well demarcated to avoid internals. Can you hear me? It must be well demarcated to avoid interference. So, and yes, if it's not well demarcated, it can lead to contamination. So, and our guideline on good manufacturing practice, that is good GMP, gives details on facility layout. If you must use an adapted building, maybe you want to use a flat in a building, then it must be fully demarcated. People living inside that compound must not have the same entrance with where your facility is. So, and you can go to our website and contact our guideline for further details.
Bob, we need the...
So, there's another question. Another question, whether government agencies can ensure, whether they can ensure that water products are well analyzed from rural areas. I don't know whether I'm getting the question. Can the question come appropriately? Can you hear me? Can you hear me?
Can you hear me, ma? Can you hear me? I can hear you. Can you hear me?
Yes. I said the second question.
Yes. Are there processes by appropriate government agencies to ensure that water from boreholes dug by individuals in villages or communities meet the minimum standard of good water quality? Did you get that, ma?
Okay. Yes, I do. In this case, we have, like in most of the states, we have NAFDAC offices in most of the states. And the states, we have people, when you apply for registration, people go there for inspection. And they will ensure that your facility is well positioned and well taken care of. And after the inspection, they will pick your sample and send to our lab. We have laboratories in most of the zones. We have in Lagos, we have in Kaduna, which is close to Abuja. We have in Agolo, we have in Port Harcourt. So these are the places they send their samples to ensure that these products are being well analyzed and the analysis will come out satisfactory before we can, before certificate, that is not that. Again, aside that, we monitor, that is, we send officers for routine inspections, that is unannounced inspections, to visit places that are registered and those that are not registered. We equally interact. We have stakeholders like ATWAP, WAPAN, all over the place, and other small organizations that are springing up. We collaborate with them, have meetings with them, and inform them the need for self-auditing and equally police everyone that is not registered, and police even themselves that are registered to ensure that they are complying to our guidelines and regulations.
Okay, thank you very much, Ma.
Are we together?
Yes,
Okay.
thank you very much for the response. I believe that the participant that asked that question, Dozirim Chibundo, that you got the answer that you actually that you expected. The next question is for the FCT Water Board. The question is from Bob Etemuku. He asks, why is it difficult to provide public water taps in strategic points for FCT residents? Can you hear me, Mr. Shehu, sir? Hello?
Yes, I can hear you very well.
Okay. Did you get that question, sir?
Yes, I got the question from Mr. Bob. Provision of standing water taps at strategic points. Yeah, for all the communities where our trunk line traverse, because our treatment plant is located at the lower Usma Dam, very close to Buari. That is our source of water. And this water travels some kilometers to get to the town, and as far as Gwagwalada, all the communities where pipe passes through were given standing taps, even when it is not professional to do that. Because professionally, it is not right to make any connection on the trunk line because of obvious reasons. But because of the pressure and the concern we have for such communities, we still make such provisions. We give them water from the trunk. But it is not everywhere. Those communities where our pipeline is yet to get to, there's nothing we can do, unfortunately. But right now, if you people observe, there are some parts of the city, if you are along your way, the airport road to Lugbe, you see some pipes being laid. If you are along Galadima, our axis or wherever you see. So we are trying to extend our water services to the communities that were not connected before now. So, but as soon as, like I said, anywhere our water pipe passes through, we give them such standing taps. At worst, that was the worst we could do. Otherwise, all the houses around will give some water. Thank you so much.
Okay, thank you so much, Mr. Shehu. Because of our time, I will have to I picked only two other questions, which is directed to the CEO Rite's place. And these questions were asked at the person here does Infinix, somebody using Infinix phone. The question is, in places where gas is flared, how do you purify water in those locations? This is directed at the CEO Rite's place. And also the places where you have salt water. The person talked about Ebonyi State, that they drilled water in that area, but the water that was coming out from was salty. How do you purify those? So this question is for the CEO Rite place. And before he answers the question, we will put our contact in the chat box. You can copy that for further questions. And of course, we're also going to send you the slides for the presentation that I made today because of time. So Dr. Meze, over to you, sir.
Thank you. And thank you for reminding us, please, that we want more of these questions coming. You can email us your question, reach out to us on our website. However, you can reach us with all kinds of questions for any of the speakers, and we'll get back to you with answers. But to answer the question, our technical partner, Phoenix, patented the technology in the US, but you'll be surprised to know that the CEO of Phoenix is a Nigerian man. And the Phoenix has the ability to clean water even rivers and lakes and seas. So even in areas that have oil spills, that Phoenix has technology that is able to clean the water. So if you have well that is salty or whatever, however it is, that is the contaminant that you have in the water, we're able to analyze that water. Once the analysis result is out, our technical partner is able to customize the treatment that you need to be able to get the water to acceptable international standards. And this is a claim that we are more than ready anytime to defend and to stand by, because we took some time to be able to analyze what is available before we partnered with Phoenix. So to answer your question, whatever the condition of your water is, we get the first analysis. Based on that, we customize your treatment. And then at the end of that, we will now get another result, analysis to be able to confirm the result. And then we will recommend maintenance services at intervals of what needs to happen to be able to maintain the quality of the water. So the emphasis then will be on those regular maintenance to be able to ensure the quality of the water. I mean, it doesn't matter where. We are ready and we are able to meet you. And I'm sure that the CEO of Phoenix is probably somewhere on this call. Thank you.
All right. Thank you very much, sir, for the response. And I believe that the person that asked this question in Phoenix phone, you didn't put your name. And I want to use this opportunity to thank everyone. And I will finally want to hand over to the CEO, Right Place, to do a closing remark, which will bring this dialogue to the end. So over to you, Dr. Chibeze Okolo.
Thank you again for having me. I am very, very happy and to be host to this event, especially to our speakers, Mr. Mohammed Shehu, that has been smiling all through. I appreciate you for coming, and I'm going to visit your office very soon, so we can further this discussion. Mrs. Ilopiti here, I appreciate you as well for your contribution. I understand that we didn't give you enough time to do all you wanted to do, but don't worry, we are planning a conference that will give you all the time that you need, so we can do justice. And our first speaker as well, thank you very much for coming. Everybody, it is our honor to host you, and we appreciate you as partners with us in this move. You can see from all the participants that the subject of water is a very important subject. And if we can get it right with water, then we'll be moving in the right direction with the health of our people, especially the poor in the rural villages. And we are still talking about water quality. We haven't even gone into the details of the neglected tropical diseases. We haven't even gone into every malaria, typhoid, diarrhea, all kinds of water-related and waterborne diseases that are plaguing our people every day. We have to do something about this. To act is now. Again, please don't forget that we'll be calling on you again soon. We'll be having one program after the other, and God helping us in the new year, we'll have a lot of programs that we'll be able to see how we can all come together and join hands and synergize our ideas, synergize our resources to be able to move water quality in the right direction. Once again, thank you for coming. God bless you. Let the emails come, let your questions come, reach out to us anywhere, and we'll make available to you the slides for this presentation. And then we also make available to you the slides from the conference that we just had. Like I said, that one of the topics we discussed there was, is SDG number 6 achievable? That was what I tried to have a whole slides on that one. And the other one is neglected tropical diseases. How well are we doing? And how they are related to water quality. So all of this you can see on www.riteplacehealth.com. Please follow us on Facebook, follow us on all the social media, and thank you for coming. God bless you.
All right, thank you very much, everyone.
Thank you so much.
I
Thank
would
you
like
for
everyone
having
to
us.
on their
Thank you.
video. We want to take a screenshot so that you appear on the on our photo. Just put on your video for a second as we take the screenshot. And thank you everyone for coming. This is the first edition of this dialogue. Actually, we will also be calling on you from time to time about our program. Of course, those who registered will have your emails. You'll be receiving newsletters from time to time about our activities, and we'll also invite you to every program that we're doing going forward. Thank you, everyone. The photo shot is being taken now. Okay. Are you ready? Taken? Okay, we've taken. Thank you very much, everyone. I appreciate you being here. We spent more than close to 2 hours here. Thank you very much. Thank you. Have a nice day and a beautiful day. And while you're out there, remember that we need to drink safe water. So be a partner. Do whatever you can. Reach out to us. We'll be ready to partner with you at any time. Thank you very much, everyone. Have the best part of your day. Bye-bye. You can end it.